Welcome to the Equine Aqua Spa Center. Are you ready to see the incredible vision of Ramona Caldwell? Like I said, come on in. So this is the prototype of the healthy horse body wear where Stephanie actually created this, and this is the beautiful Ramona Caldwell that owns this incredible spa for horses. So Stephanie, tell me, what version are we on now? Because I know that this has evolved tremendously since you started this prototype, what, in 2004?
This is version 1, and it has evolved to version 7, which we're going to utilize today in our demonstration of the energy and fractal images.
Video out.
Yeah.
Okay, bring that one up.
Gena?
So this is Noogie, and Dr. Gena is going to start putting the body wear on Noogie. You'll notice the difference in the body wear right away because there's pictures all over the body wear. And this is a critical point, as I move around the back of that horse, the critical point in showing these fractal images, that's what they're called, because they actually have energy in the geometric shapes, which we call sacred geometry of the actual pictures or shapes. And these are available in the life systems in 2 different programs of the life system. One of the things I wanted to show you was, first of all, how incredibly good this fabric is. This is a very high quality fabric. This is not going to tear easily. And what do we have? Stephanie, what do we have quality-wise on this product? Or Connie?
It's a Lacrosse 4-way spandex.
Okay, and this is stretchy. More importantly, every area of the horse is identified, every organ of the horse is identified by a fractal. And therapeutically, Dr. Gena, how does this work therapeutically?
Well, therapeutically, each one of these represent a fractal, and as we know, each fractal has its own specific energy. And these fractals, they allow this energy to enter into this horse at a consistency. You don't have to do anything else other than put the suit on for the energy to get into the horse.
The important thing is to watch the horse, how quickly, first of all, that they were able to get this on. This is not a struggle. This is an easy thing to do with one person. And the other thing to watch is how calm the horse gets after putting this on. And they do have suits for dogs as well. So we're talking about multiple. In fact, one of the dogs that's running around here has a little cape on it, and that is the energy for the animal to calm down. That one particularly is, I think, calm and stuff. But here's the interesting thing. People ask this all the time, do the energy of fractals wash out when you wash the garment? And the answer is no, because they're based on sacred geometry. So we're not talking about something that has been printed on that has no relevance other than color. The shape of it and the sacred geometry of it, which we'll discuss in a little bit at a tabletop discussion, is the important part. Does it mean that this has to be pointing in for the horse to receive the frequency or for an individual to receive the frequency? No. Because of the sacred geometry, the frequency is created in the shape. It is absorbed in as well as it's coming out. Now the other thing is, now humans will benefit from this. Just looking at the pictures, humans will benefit from it. So this is the latest version. We're at version 7 of this, and Stephanie has done a fantastic job of continuing to evolve this. This is a wonderful suit, highly recommended for anybody that has an animal that needs any kind of work, but also just performance-wise to have a better quality performance. Isn't that right? Isn't that right? Yeah. Okay, thank you very much. You're beautiful. All right, you recognize this. This is our life system. And Gena, what she has is the Beauty for Life kit. Now, Dr. Gena is actually going to use this in a little different way. We're not working on the horse for a beauty concept, but she's actually going to apply this to the horse for layering effect of frequency. Gena, tell us how to do it and show us how to do it.
We use the roller so that we can deliver a larger area of frequency there, energy, and we go over here to each one of these fractal images and we just simply roll it across. We roll that across which area that we want to work on, and it layers the effects of the frequency in there. And we do it for about a minute is what we do. Duration is about a minute.
And how does the layering actually benefit the horse? So we're talking about layering, so we're using the fractal images as one concept, and then explain the layering concept. What does that do?
Okay, these fractal images, they take in the energy at a consistent rate. They do it all the time. You don't even have to have this tool. This tool just adds more effect to it. It gives you an extra energy that's put into that fractile for the animal to use.
So this is absorbed 24 hours a day, 7 days a week. What she's doing, well, as long as you have it on the horse.
As long as we have it on the horse.
As long as you have
yes.
it on the horse. What the wand is actually doing is layering additional activating frequencies on top of the fractals that she's working with specifically, although you don't have to stay on the fractals. You can, of course, go up and down the horse, but the key is to activate the frequencies even more, so he's getting an even deeper frequency concept. So it's additional, what I like to call additional layering of frequencies, and it's just multiple modalities combined, of course using the life system and the applied capability of the life system in different ways. So this has been really beneficial to the horse. Have you found that the horses heal even better and faster?
I have. And perform. We have, there is, for performance horses, we would like to use this blanket. I mean, we have the heart that we can work on, the oxygen intake, the respiration, and we have found that it really helps them perform better.
Right, so people have asked, is this just therapeutic, as in if there's a horse is injured? But you use the term performance horse, so explains that a little bit
Yes.
more. We're not talking just an injured horse,
No,
correct?
no, and by all means it works for injured animals also, just your healthy animals that you want to keep healthy. It also, it just gives them that extra energy balance that they need. And the performance horses, they get pretty sore after working a while. So this blanket, it draws that energy at all times. You don't even have to be there for it, and so it just enhances that performance. It makes the animal a little more sound acting and feel better.
Right.
Overall performance is a little better.
So Meatball, the horse that you saw with the red bodysuit on, Meatball, we dressed in the bodysuit, about 4 o'clock yesterday afternoon,
Yes.
and he continued to wear it all night long. And this is an incredibly fine quality product that we just made sure that it wasn't a hot day, because just like any other horse blanket, you wouldn't want to dress a horse in a horse blanket when it's 100 degrees outside, right?
Right.
And Stephanie, is this cloth water resistant as well?
Yes, the cloth is very thick. It's made out of like jersey material, the Lyrica, and it does repel water. So it is water resistant.
And you can see how the horses love this.
Yes.
I mean, he's just calm, he's just enjoying it. Meatball didn't want his bodysuit off this morning when we took his white bodysuit off. So this is the whole point. We're going to be talking a lot about fractals today, what fractals are, and again, we're revisiting the different aspects that you can use the fractals. But Stephanie and her associates have worked a really long time, many, many, many years, creating such a nice product, excellent quality product, very, very sturdy. A horse can roll in this and it wouldn't hurt him in the slightest bit. It wouldn't hurt the bodysuit in the slightest bit. So this is a really cool use of fractals outside of the human realm into the animal realm. And the little doggies running around have a little cape on that have a fractal on it, and they also have a dog suit as well.
Not only are the organs represented, we also have a fractal image here for muscle stimulation to help balance out when they have been through a hard workout. We've included the solar plexus, from the spinal area, and also the bladder meridian, which each organ is represented on the bladder meridian as you go down through here. So it can be utilized through using the organs or the bladder meridian with the Beauty for Life roller. Or you can use the Beauty for Life acupressure point also.
This is the roller, and then there's the actual acupressure, what people would call acupuncture, but we call them acupressure points that we use the actual wand with.
We also utilize the acupressure probe in the Beauty for Life kit, and we use this along with our biofeedback system. And what we're doing is we're going with a more pinpoint location for these acupressure points. We're treating for muscle pain, and we're giving the relaxation frequency on that. And we also do this for about a minute. And I like to just trace around the fractile myself. And you can just leave it in one area.
If you watch the lip will start to move and the tongue will come out. They'll also lower their heads. She is now working on the calm button fractal, and you can see his eyelids are starting to close even. That's how calming this is for them. And he's starting to lower his head.
And you can actually feel his muscles relaxing as we do this too.
So Ramona, you've been with this show horses and in the show world for years, and you've used multiple kinds of modalities with the horse. When you come to this blanket with these fractals, you're noticing this calming atmosphere of the horse. But as far as performance and as far as rehabilitation, are you finding this one to be one of the most effective combined with some of your other technologies?
Oh, yes, and it's we have every piece of technology that we do here. And I go back to the basics every time. Put the sheet on the horse. Let it spend the night here and let's see what it is. And through biofeedback, we kind of know what to look for to go to the direct fractals we need, and which ones we need to work with. But you can see and lowers his head, he wants his attention, and she's on that calm. His ears are separated. He's not looking for anything. He wants me to rub his nose. So that tells you the endorphins are going. See how he calmed down? He's getting reaction from the endorphins.
The eyes are closing.
He's a happy boy right now.
Now, Ramona is a practitioner, so she has been using the life system extensively with the animals, the horses, and her other performance animals as well. It's not exclusive to horses. It's pigs, all sorts of show animals.
Pigs, goats, show cows, even an iguana one time. And that was interesting.
I'm sure the iguana suit will be coming in the future.
Yes, it's in phase 5.
In 2050.
2050.
Thank you so much.
Well, thank you for coming to the Equine Aqua Spa, and thank you, Newbie, for being a good boy.
All right, I thought it would be interesting if everybody here is a practitioner and we're from very different backgrounds, and I thought it would be really interesting if we just take a minute for a roundtable discussion, because there's a lot of conversation about whether we are dabbling in New Age concepts or psychic or mystic concepts, and I think that merits a conversation over it. But first of all, I want to go back and introduce everybody.
This is Ramona Caldwell. She's an amazing owner and developer of this Equine Aqua Spa Center. And she's also a multiple champion, world champion showwoman and owner of the infamous halter horse One and Done. She is also a practitioner and again uses a lot of the life system and biofeedback in preparation of the performance horses as well as conditioning. Stephanie Holland, she's from the Biofeedback Wellness Center in Waldron, Arkansas, and is the originator of the Healthy Horse Bodywear. And her partner, business partner, Connie Ray, she is a licensed practitioner in counseling and drug alcohol counseling as well. Gena Keeling, we met already. Dr. Gena, veterinarian of large and small animals for over 30 years from Southside Veterinary Clinic in Waldron, Arkansas. And Tanya Lee, to my left here, who you have not met yet, is a life coach with TLLC, right? TLLC in Burke Burnett, Texas. So all of us are practitioners. Tanya Lee happens to be the newest practitioner, and I thought it would be really good to have some of this open discussion on some of the aspects that we've looked at so far, which includes the fractals. Again, my name is Dr. Alisa Rich. I come from medicine. My background is an NIH-trained scientist. Data is my middle name, and my practice is the Energy Shop out of Plano, Texas, as well as a few other places. Really, one of the aspects of the life system is how varied, I think is a good way of saying it, how varied with multiple programs we can use or not use depending on how somebody is comfortable using it. But today we want to talk about the fractal patterns. And I find them particularly fascinating because they are based on sacred geometry. And everybody gets real excited over the term sacred, and instantly I'm hearing voodoo, mystic, psychic, don't go there. But reality, Dr. Gena, we just picked up a leaf, and the reality is this not a sacred geometry pattern?
It's created by God in heaven. And if you look at this, you can see those fractile images on the leaves of the vine.
So it's fascinating. The fractal pattern is actually part of the mathematics of the whole universe and is the basis for all science and physics, and obviously part of the human body. When we look at different aspects of the human body, you know, Stephanie, you and I were talking about the branches of the lungs, yes. And when you look at a tree outside, turn it upside down, and what I see is a trachea. What I see is bronchi. What I see is bronchioles. Is that not the case?
Yes, it is.
So when we're working with these fractals, do you feel like there has been maybe a misunderstanding or misrepresentation of them as energy instead of them as sacred geometry of nature?
Yes, I mean, they are odd-looking characters.
Mm-hmm. True.
But if you look at the structure of the human body and the way it's layered, each layer separate are odd-looking structures, but together it makes the human body, which is whole and complete. Mm-hmm. And that's what these fractal images are about, mm-hmm. is a whole, complete balancing.
Mm-hmm. And I think it's fair, I mean, I hope I'm not out of turn here when I say I believe we're all Christians here. We come from fairly different backgrounds. I came from a very, very conservative Christian background. Cards weren't allowed in the house, mm-hmm. let alone played anywhere. Yeah, but they weren't even allowed in the house. Now, as I have evolved, I've realized there's so many misconstrued and possibly taught concepts in Christianity, one of which I always get flustered over when I have somebody in my office and they say, do you have one of those chakra programs? And I'll say, yes. And they say, don't use it on me. Mm. And well, isn't the breastplate of the priests in the Old Testament the chakra stones? Right. And they were sacred for a reason. They protected. So that just always kind of throws me off. I want to say, do you not understand biblically what they mean? Did you not understand the power? Now, I'm not getting the stone power, mind you. I'm not picking the stone up and I'm saying, oh, the stone is my God. I shall pray to the stone. Although many of them I would like on my fingers.
Yeah.
Yeah, but does anybody else, does that resonate with anybody else?
Well, and God designed us with that solar plexus nerve system, and that is designed after the chakras. I mean, it runs concurrent with it and works in a similar way because it runs energy through the body. So that's the way that I look at it, and I try to relay it to my clients.
So really what we're doing, even though I won't use it, if I do have somebody who's really uncomfortable with it, of course I respect them, I won't use it. But aren't we just opening that area, just much like you would relax your spine, you're opening the meridians of your body so that the energy flows, so you don't have a screaming muscle because it's not getting it's not generating. Isn't that what we're finding in the horses?
Yes.
Those fractals activate?
Fractals activate the energy. And you might want to stop and think that chakras and the meridians have been used in the world for over 6,000 years.
Thousands.
So maybe they knew something there.
Exactly.
And I think modern medicine, big pharma, all that, don't want us to know something's out there different because we're so, from the moment of birth, it's take a pill, call a doctor, that we were not taught, nor have my generation, how to combat the natural part of healing. And fractals is part of the natural of healing because healing is energy.
Yes.
Well said. I do agree with Stephanie, some of the pictures are a little weird, right? Some of the pictures are a little odd. But my background is my mother's Native American. So she actually taught us a lot of alternative healing early on, which it was kind of funny because every now and then it would be like, I need an aspirin. And she would say, go peel the tree.
Yeah.
We're like, come on, Mom, just give me an aspirin, right? But she was it was very instrumental, I think, in my later years of understanding nature and being more considerate to trying other things because it was effective. I mean, we did learn how to take some stick out of a tree and not the twig with the brown stuff on it, but we did learn things like that were really effective. And that's been lost.
Yes, I have an old recipe from my grandfather's great horseman. He would bring their horses to him all the time. And to this day, he's been gone 55 years, I use one of his old wound healing formulas. And it's bacon grease, turpentine, and garden soap.
There you
And it will work better than the $60 or 3-ounce tube that the veterinarians that they sell me.
Well, there you have it. It's one of the secret formulas that Ramona just gave out. But there's a lot of things like that. Even the beeswax is used therapeutically, isn't that the case?
Yes, it is. And now they're using the honey too, therapeutically.
Lots of honey.
Yes.
The bottom of that honey hive is a product called poultice, and the Amish, it's real sticky, gummy, and the Amish use it as medicine on their horses.
Oh, interesting.
And I've used it a lot. It's very sticky, but
It's a great wound killer.
it's an incredible
Antiseptic. Isn't it known as an antiseptic? Right, that's fascinating. So we will get into a full discussion, or everybody will have an opportunity to give you almost like a 3-minute discussion on things later at their office, so you can see a little bit of how we're working with the life system and some of the unique properties of it. And I know, Tanya, you're fairly new in this, and you had asked me a question. Now, I come from a conservative background in healthcare, NIH trained scientist, and she said, well, do I have to go to medical school? Do I have to get a nursing degree? Are you seeing how you can create your own
I'm going to use the term clientele demographics, much different than what I might do, because I'm getting stage 4 cancer patients and trying to, you know, take care of my practitioner, one of my practitioners now. She was a liver transplant patient that no longer needs a liver transplant and came to work as a practitioner because she's so excited in her healing. Can you see how your practice may be very different because your background is different?
Absolutely. The medical terminology is intimidating initially, but your phone is in your hands within 2 seconds of looking it up yourself. And when you start, and you're starting with friends and family, they're graceful when you're looking up these things. So you have time to acquaint yourself with terminology and be able to see what you're looking at. But she had told me in the beginning it's like sticky notes. And when you're going through each profile within the system, things start coming together even without the background, the medical background or the science background. It starts coming together because it still is English. You know, it's still in English. Some of the things I've never heard of within the system, but there's all of these women at any time you can reach out and say,
That's right.
help, and they're quick on the gun to explain it in English and layman's terms, so absolutely. And if you're in psychology in any way, when you're dealing with an emotional stress, it shows up. It's incredible what the system will tell you. It's just incredible.
It's incredible what this system will tell you about animals. And when I'm doing a lot of the horses and the dogs, I'll say, oh, and your horse is alienating, and they'll go, yeah, how did you know that? One of my famous ones, I went to a barn, a racehorse, and it was losing races, and it was back and forth weaving, and they were feeding it in the what. I said, a rank that says, neighbor conflict. So we moved it to another stall, and then we started animals back on the track. So these animals have the problem is transposing the English into dog or cat or horse language. A lot of times I ask her, she has the medical background in veterinarian, and she'll send me to the right place. And going back to that, I don't have a medical background either. You just ask questions. You just ask questions. And then it gets to be fun. You just learn everything.
Yes, absolutely.
I'm noticing that animals are so drawn to these fractal images. I created a cloth about the size of a handkerchief, and my animals, my cat and dog, actually fight over who gets to sleep on that little handkerchief with fractal images on it. They love it. They're drawn to it. But if you notice, and I've heard Ramona say this, and I've heard Connie say this, that people come into their offices, and that's the first thing they're drawn to is if they see, you know, the pillowcases or a bandana laying there with the fractal images, they're drawn to that.
Absolutely.
And I can relate to that because I learned early on in my practice that I could piggyback off of someone else's biofeedback session. And so if I had something going on and it happened to come up, while I was doing the rectification, I concentrated on the fractal image on the screen. And that helped me because, as you know, in a busy practice, you're the last person you have time to work on.
And this is for yourself.
Yes, but the fractal image allows you to piggyback.
Yeah.
You're helping someone else. You're giving them the same frequency via the headset, but you're receiving it just by looking at the picture on the screen.
Exactly. So just by literally just looking at a fractal image on the screen, you can feel your brain change. And I think and it's not changing in a bad way. It could be calming down, it could be whatever. And I think that people don't realize that you don't have to look at it. You know, you can wear it. It doesn't have to be turned inside, touching your skin at all times. We've gone through that because what the sacred geometry is a pattern that exudes frequency. So you don't have to wear it underneath your or on a t-shirt turned inside out. You can wash it. The pattern's not going away. But what's really cool, I love the concept that the cellular level, your body absorbs the frequency that is exhibited in this sacred geometry and actually
instead of having a disruption that we have with our industrial world so much, we're having almost just the opposite, a calming of an area and a restructuring of an area by using that fractal pattern. So we're getting less stress, we're becoming ordered on a cellular level, and isn't that what a lot of disease is? It is a disorder on a cellular level, an actual disorder on that level that causes a dis-ease or disease, correct?
Correct.
Is that an accurate statement,
That's
Dr.
accurate.
Gena?
That is accurate.
So anytime you look at a cancer cell, you can see the disarray in a cancer cell, and we will have some pictures that we're going to present that you can see how orderly nature is. Again, God is not a disorderly creature in any way, shape, or form. He's a very orderly creature, and nature is an orderly creature. Anytime you look at a river and you see a river flowing into a stream, flowing into, you all call them something different here. Let's say a stream to a creek. Right. We would say arroyo, but a creek's good. That's a perfect example of the fractal and how a fractal moves. Now we have had, let's see, we'd say adulteration at times where they've been brought into more of a mystic concept or even with a religion that some people may not align with, shall we say. I think it's important to come back to what nature's all about. And I frequently say, if I can see it in nature, I'm more comfortable that it makes sense. But one of the things I have to, do you have one of the pillowcases? Stephanie had created these lovely little pillowcases, and they have different images in them, but the bee is particular, the honeycomb of a bee, the bee honeycomb, how do we say that? Honeycomb of the hive, right? Is a classic geometric shape. I mean, if you just look at the geometric shape of it and the honeycomb and the structure of it, it's classic sacred geometry. And I have to tell you a really funny story about the pillowcases. I do love the pillowcases, but I'm a pillow thrower. So in the middle of the night, I put my lovely little pillowcase on, and I was so excited to receive the pillowcase, and I found the dog sleeping on it in the morning. Now I have no idea what time of night or even how long I had this pillowcase, because I literally grab pillows in the middle of the night and throw them off the bed, and they land all over the bedroom, and I have to be careful in the morning. But what I did then, because I was disappointed in myself, I will tell you, I grabbed my coffee, got back in bed, and put my pillow with the pillowcase, just like this, back in bed, and I was drinking my coffee, and I felt like the bed was shaking, just slightly. And I thought, that was weird. I wonder if one of the dogs is like doing something under the bed, like kicking, the post or something under the bed. And I sat up a minute, and it stopped, and then I leaned back against it, and it started to do that little thing again that I call it a shuddering. And again, being the very logical NIH trained scientist, I was not going there, and I said, we're not gonna comment over this. Drank my coffee, went to the office, and I asked my associate, who is a practitioner, she's the liver transplant and no longer needs a liver transplant, and I call her Earthy Crunchy, because she loves delving into the earthy crunchy realm, right? So she had a pillowcase, the spleen and the liver one, so I was very proud of her. And I asked her, I said, did you sleep with your pillow last night? And she goes, oh, yes, it's so wonderful. And it is. And I said, did you feel anything by chance? It shakes. And I was like, okay, all right, I'm not insane. I did not have a moment there where I lost it. She said, yes, I felt it. I actually felt the vibrations. Now, it was a very subtle vibration, but nonetheless, when she said that, I was like, it's real. And how fascinating. So, we did have a conversation that we had where it's like, So this is what we call the layering effect. Yes, we all use the life system, do we not? Do we not love the life system?
Yes.
Love it.
Yeah, and I loved how Dr. Gena used the roller in a totally different application than what the beauty kit had been given to us. And I love this concept because, again, we're layering frequencies. And you made a comment about tracing the actual fractal.
Yes, with the pinpoint one, I just trace around the fractal and just go around, just like you're drawing that fractal in there just to distribute that energy.
So the way I had to deal with my pillow throwing, because pillows will be thrown, that's a habit that I don't believe I'm going to get out of. I took the pillowcase and I actually layered it under my sheet, under the fitted sheet of my bed, because that way I knew that I was getting in full contact with it. And the one particular I was working with was the spleen one, and obviously I'm laying on it in the middle of the night, and that's what I wanted. I really wanted, I want that contact, right? Does it work 10 times better if you don't have any clothes on? No. In fact, does it work better? I don't think it works better at all. I mean, although I can't honestly tell you I have any studies on that. It's the pattern, is it not, that has the energy to it?
Pattern.
It's the pattern.
Yes, and you'll catch yourself, when I'm showing them this, one of my sales tools is, I talk to them and they're staring. I said, are you having a hard time taking your eyes off of one? And they went, yeah, they are drawn to the fractal that will help their body. And then Dr. Gena can show you what we're doing, the girls are doing with the dogs, with the bandanas, to move about animals.
Is this worm?
This is
Worm.
Introduce worm.
And Worm has a peaceful pet bandana on, and this also has the fractal images on it. And in Worm's case here, these images represent the ear and the eye. He's had some ear and eye issues, so he has a fractal pattern for the ears and eyes to kind of help combat those energy imbalances.
And just like with the horse, he's not looking at the energy
No,
or at the
no.
symbols, but the energy is still being.
Yes.
Exactly.
Just a gentle frequency
Yeah.
while wearing it, yes.
Yes, that's I think what's really important is people understand you can look at it. You can look at the fractal and feel whatever energy that you're gaining off that particular fractal. So calm or happy or whatever. You can look at that. It feels differently, but it doesn't mean you have to look at it. You can wear it without looking at it at all. And I think for us, I really appreciate the effort you all have done, and I am always thankful to Grace Gow for all of her constant encouragement that she gives us over expanding and the use of the life system. And I don't think that the use of fractals has been really well used, don't you, Brian? Yeah, I think we, right there, looking at the potential of the fractals in many ways as therapeutic.
We're so overwhelmed, I think, because of the amount of information we have in the system. I mean, you will never learn everything, you learn every day. And I think fractals was one of the things we overlooked, learning the system. And then once we kind of opened up to it, and then Stephanie and Connie go, blah, blah, and all of a sudden, everything in life to me now is a fractal.
Yes, you see the pattern, you see the pattern. What did you not say about the animal prints yesterday?
Oh, last night, she had a beautiful animal print, cheetah or leopard, whatever print, jacket on. I said, oh, that's pretty. And I mentioned to her, I was driving down the road the other day, and I thought, why does animal print never go out? Why do women always want to wear it? It doesn't matter. Because it's a fractal.
It's a fractal.
Those animal print clothes are fractals.
Yes, and we're drawn to that because it's balancing. It causes us, to have whatever energy that particular fractal has, and I think that's fascinating that we're drawn to that almost.
Particularly women, I don't know about the boys, they kind of go for the camo, but us girls.
It's a fractal.
Yeah, that's right.
It's a fractal. So interesting, Tanya and I had this conversation yesterday, and there are programs that I will never thoroughly learn, and I'm sure, Dr. Gena, you feel the same way. I mean, my practice is conventional medicine. I come back, I'm a toxicologist, I have conventional medicine background. I have been steeped in it for decades, as you have been
Yes.
with veterinary medicine, right?
Right.
But Tanya and I had this conversation. I said, at some point, you have to realize that I can't be everything that the life machine offers to us. I can't get to the depths of flower essence. I can't get to the depths of Ayurvedic. I mean, that's another 3 decades to learn some of these things, isn't it?
Yes.
So I tried to direct her on, don't get overwhelmed. You know, you have an expertise. You do have a wellness business. You are very well adept at that. Go into the areas that you have total confidence, right?
Right.
You want to illuminate a little bit of what we talked about?
Well, I mean, like you said, there's 39 profiles in the first reactivity side of it, and then behind that in the wellness profiles, there's all the others. So, like you said, when the sticky notes start coming together for you and you start seeing the pattern, then it becomes second nature of comfort of this is where I'm going to be. And for me, it's spiritual. When when I first started, I'm like, I have no idea what I'm looking at. And anytime with any software, you get used to what you're looking at, but then you start leaning on, after you see the different pages and the different profiles, you start leaning into the spirit to guide what's next or where to look. And I personally have had experience with that when my mom was in the hospital in Odessa, and I'm on a beach in Mexico, and they're freaking out because they're taking her in. I run the system, and I just pause and ask for guidance, and I see it. She has chest pain, she has congestion, she has pneumonia, and it shows me. And so I could see before she got the diagnosis from the doctor, and I'm not a doctor, but I could see it.
You don't need
Yeah,
to.
and I could see,
She's
yes,
going through.
and I could see the
All the
energy from the stress potentials that were showing up. So I could send her frequency, and I can also say the fractal images. I sent my sister pictures of the fractal image and said her heartbeat was erratic. She was in AFib, and I said, show her this, show her these fractal images. And she showed her the fractal images, her blood pressure dropped, her oxygen went normalized, and her AFib stopped, and she went back into rhythm over 3 fractal images. And I said, when she starts having anxiety, show her this fractal image, just have her look at the fractal image. And she, in real time, is saying, oh my God, Tanya, it's working, it's working. Her blood pressure just dropped 2 points. And she shows her, within a minute, her blood pressure dropped 32 points.
I think we've all said, oh my God, it's working.
Yeah.
At some time or another.
Yeah.
So I have to get back. This is kind of some of the fun stuff, you know, as we are going through and thinking about some of the, I'm going to use the term, the wins, you know. And if I just let me finish up, wrapping up something that you said, by the way. I have gotten to the point that I am very good at referring people to somebody that has the right practice. You know, so I think that's really important. Connie, you have a great background in counseling and drug addiction, and I have less patience in that got because, first of all, I'm not trained in that area, but I also come from an exceptionally disciplined background, and actually got addicted to morphine when I was 14 years old and had to cold turkey off of it. And I guarantee you, ain't nothing gonna get near me that I have to cold turkey off again, because that's one of the worst experiences of my life. However, I have a difficulty understanding, because I did go through that, how to work with somebody like that, because, sorry, I come back to, you know, yeah, I went through hell, but I came back because I wanted to rush through hell as quickly as I could. So Connie would be a perfect example of somebody that I would refer one of my clients to. I don't have enough time. I don't have the training that you have. You have a double master's. You have a master's in counseling and drug as well, right?
Right.
So here's the perfect example of how I can use her expertise to benefit my client, because I'm never going to go there. Not that I don't respect what they're going through. I do. I don't want anybody to think I'm callous. It's just I can't do what you do, correct?
Right, I mean, there's a lot of emotions and things that come up along with that you've got to look at and address with it, because, I mean, it has changed the brain, you know.
Absolutely,
So,
well said,
it's
yes,
important.
absolutely. And the fractals are so important in getting that brain balanced again. And I know that a lot of people, you know, they're gonna think that we're woo-woo and you know, weird new age or whatever. Just try it.
Try
I mean, work with these fractals, try it yourself and see what you can do. I think we've all been to that place using the life system at times where you're like, oh, okay, I don't believe that just happened. And I want all of us to tell one story that really is impactful to you, that might get you, you know, one of those where you go, I didn't think this was gonna work, but I went ahead and tried it anyway. So, Dr. Gena, you wanna start? And
Well,
just,
I'm going to tell one about myself, if
Okay.
that's okay.
Sure.
I was diagnosed with some really bad back issues, and it was inoperable. And they told me it wasn't going to turn out good. And so my husband and I, we prayed about it, and I ran into Stephanie's husband, and he was chopping around like a little jackrabbit out there. And he told me that Stephanie had been using her biofeedback machine on him. And so, like I said, my husband and I had prayed about that, and the next morning, a couple mornings afterwards, we ran into Stephanie at the diner, and God just laid it on my heart and to talk to her, and she said, "Oh, well, I have an opening tomorrow. I can do you tomorrow." I think we had 3 sessions. I mean, it was better after the first session, and I literally could not get up. I was in so much pain. And so after 3 sessions, I mean, I was like, you know, I'm pretty flexible right now. And it, you know, to me, that was just a miracle that, you know, that God's placed in our hands that we can use for other people to help their life. And so that's how I first became acquainted with the biofeedback system. And I thought, well, this works so good, I want to share it with my patients. And so that's how I got started. And I do use it. I do use it on cancer patients quite a bit to help them.
yeah.
And that's probably my biggest. And I do goats with it a lot too. But I think
She did say goats.
Goats.
Anybody goats? She did say goats. Okay.
yeah, I do those goats. And
You'd be surprised what we work on, people.
and they seem to take the frequency pretty good.
Yes, because they're not arguing.
They're not.
Yeah.
But that's my biggest, that's how I got started with it, and then I've incorporated it over, trying to, and I'll be honest, I have problems getting some patients to, clients to be receptive of it, and others are really eager to try anything for their pet.
But I respect that. If
I
they
do
aren't
too.
comfortable
I do too.
in a program, if they aren't comfortable doing something, I would say I don't ever want to force anybody with anything, right?
Yeah,
it's like
right.
allow them to grow into it, allow them to experience it
And you
in their time.
That's right. And too, a lot of it is you just have to explain the system, just like we're doing here today, because they're a little leery of that. And another thing I like about the pillowcases and I think the bandanas that they're coming out with is going to be awesome. They had the Calm Pet, and some of my patients that we see are what we call on the terminal list, and creating these fractal images that absorb this energy that this pet can be receiving at all times. Comfortable.
Yes.
It increases their quality of life, and they don't have to be stressed. When they bring them into my office, they get stressed.
Right.
And sometimes I'm just checking them over, and they're more worked up that way. But these fractal images that are balancing their energy, it does seem to help them.
And Stephanie did say that the dog suits are coming. Connie, do you have a story?
I do. I have so many, it's hard to choose.
Right.
I guess I'll choose my husband. He's had so many medical problems. He's had hip replacement, a pacemaker, prostate cancer, rheumatoid arthritis. I mean, he couldn't even bend over and put his socks on. He had just pretty much given up, where he basically sat in the chair most of the time. And after I started doing the biofeedback on him, and I even made a quilt with the fractals on it for him to sleep under. He was back this summer baling hay.
Wow.
Baling hay this summer. Okay, anybody who has baled hay before, that is not a young man's job. I mean, that is a major. And was your reason for purchasing the life system to actually help him, or had you?
Yes, it definitely was.
Exactly. I think you're going to find a similar tone through a lot of people. Stephanie, what about you?
My husband also had 10 heart attacks and 9 stents, and actually was given 6 months to live. And the life system has changed things completely. What's really interesting though is, you know, I'm balancing him and he's getting better, but the pillowcase, that was a game changer.
Really?
After he started sleeping on the pillowcase I designed for him for circulatory respiratory, he got up the next morning and said, I can breathe deeper, I can walk farther, and it's a game changer. It's been a game changer for many of my clients, diabetics, helping balance their system where their blood sugars aren't going sky high. I have multiple diabetics that will not go without their pillowcase. People with insomnia, you know, I have multiple testimonies of people, you know, they don't want to go anywhere without their pillowcase. And in fact, I've had them say they went on a trip and forgot theirs and they were very upset because it is something, even myself, I do not want to go to bed without my pillowcase.
They're obviously not pillow throwers.
Yes. I make sure my face is laid right on my fractals.
I haven't gotten to the point, I just put the pillow on my face, but it doesn't stay there.
But, and like I said earlier, the cat that really loves the fractals, and he was born premature, and I raised him from a bottle. He had a chronic respiratory issue, and that cat expects you to cover him up with that, and he lays there and he breathes normal. He sleeps under it, he breathes normal, unless the little Jack Russell steals it from him during the night, and then he might be a little stuffy, but it has helped him tremendously. So tons of wonderful results.
Yes.
I can say when we came in yesterday at the spa, you hadn't set those out on the countertop yet, and the cat was doing its own thing, and she went and laid all the different pieces up on the pillowcases up on the shelf thing, and I look over and that cat is checking them all out. And then does a little spin and lays down, and I took a picture. Yeah, I'm like, she knows.
Yeah, she feels it. Ramona, you have a story you like?
Well, it would be animals. I was working one of my horses here. It was my own personal horse, and she just was antsy. She was irritable. She just wasn't herself. So I thought, I'm bioing her tonight. So it was her first reactivity, and I hit her emotions because it was very emotional. I could feel that she was emotional. And it came up neighbor conflict and fuzzy character. And I went, what? The neighbor I knew, she didn't like her stall, but the fuzzy person, I was like, fuzzy, I've never seen that.
This is in the emotional program, by the way.
If you see it, tell me where it was. It was late at night, maybe I read it wrong, but no, it said fuzzy neighbor. So I come into the barn and I'm looking at that horse. Well, we'd have this stray cat come in that sat above her stall going, meow, meow, all night long. Fuzzy neighbor.
So you took that one home too?
Cat. I know I just moved her to another barn and she got over it. She got over it.
Isn't that fun?
Cat stayed, but the horse left.
We need a cat suit.
Yes.
Put that on suit.
Oh.
Right next to the iguana suit.
Yes.
Cat suit comes first.
And I nominate you to put it on cat.
Wild barn cat, feel free. Your turn. Tanya, do you have another story?
I do, actually. The very first I got in my life system rushed to me because I was going to be out of town for week after week after week. So my sister-in-law was going to have cosmetic surgery in Miami, so I took it. I'd never even opened it. We get to Miami and I run it, and she's an RN. And so I run the reactivity prior to surgery, and it picks up that she's an asthmatic and other things that medically I didn't know that she's explaining to me. And so she was mesmerized because it was all Metaspace. I didn't even bring the harness. And so it was all Metaspace and she was blown away. Well, then she has cosmetic surgery and she was botched. Like literally she could have gone on the show botched. And so the next morning she's in such severe pain. And so I wake up and she's just moaning. You know, when you're in pain, you grunt but when you're moaning, it's a whole different level, and she's just moaning in pain. And so I pull it out, and I don't even know my way around the system, but through prayer, I'm like, okay, get me to this. So I go to emotional, and I do pain and relax. Within seconds, she was out. She was out, back asleep. And so literally she goes in for a follow-up. The doctor is asking her if she's in pain, and she said, no, not really. And he said, I don't know how. Because she had some kind of calcified fat that he couldn't get on. I don't know, but he was like, I don't know how you're even walking today. You should be in so much pain. So she didn't take any pain medication. After that day, I said, let's just see if we can stay ahead of the pain through the life system. I would work on her in the morning, and I'd work on her at night. No pain. It was incredible. Yeah, she's a believer.
And my story, I think a lot of people have heard before, but I actually had a dental accident where the dentist injected the plexus of my trigeminal nerve on the left side of my face, and I woke up the next morning after the dental procedure, and it was completely paralyzed. My eye had been open all night long. I had no feeling at all, and I had no muscle capability at all, so it literally looked like I had a stroke. So they basically I went to numerous dentists, and they said, well, don't worry about it. In 6 months it'll probably wear off. And unfortunately, it was going through the winter. It was excruciatingly painful every time I was in any cold, any wind, anything. Just absolutely excruciating. So I waited the 6 months, and I waited a year, and I waited 2 years, and I waited 3 years, but I really didn't wait. I just kept looking. I kept looking for a doctor, a dentist, a neurologist, somebody that could tell me how to fix it. And all I got was, ooh, I'm so sorry. Ooh, that's horrible. Well, in the meantime, I'm teaching at the university. I can't look like Quasimodo with half my face. So I did learn to, use the muscles. I couldn't feel the muscles, but I would say left-hand side of the face, smile down. So 3 years about 3.5 years later, I tried a bunch of technologies, and the life system came along, and I did have one session with the life system, and I'll be real straight up with you, I wasn't impressed. I didn't feel anything, I didn't have any massive revolution, that everything was working and I felt great. I felt nothing until the next morning. And my immediate thought as I woke up, I opened my eyes and it felt like somebody had just reared back their hand and slapped me on this left side of my face as hard as you could do it. And I sat up and I went, ow! And it was the first time in 3.5 years that I was able to feel my face at all. Like my fingers could feel my face, and my face could recognize the feeling. I was stunned, I was shocked, didn't know if my face was broken. I literally, because it was such an odd feeling. So I immediately purchased a life system, not knowing how to run it all, because it stayed. So I was only about 60% healed, don't get me wrong, but it stayed. So I without a doubt, I wanted more. Is it 100%? No, it's not 100%. I still have to continue to work on things. Isn't that true? Yeah, we have to continue to work on things. The one thing I have found about the fractal pillowcase, particularly when I haven't chucked it off the bat, is I actually take the pillowcase and I put it on the left side. I literally cover my face with it, and I have found that to be calming. I'm not saying that it's, again, I don't have some, hanging on issues, but I have really felt it to be calming. The one thing that I have been focusing on is looking at the image more. Okay. Do you see that, does anybody else see a difference as you're looking?
Completely.
Okay, so you have felt that energy, right?
I'm like her when I'm working a client. A lot of times, if it comes up release emotional trauma, I look at that fractal, because we've all had emotional trauma.
Sure.
You know, I'm not different. And I can tell you, if it's 2 minutes to balance that one, I try to watch it. And you'll feel the relief.
Right.
Just in yourself while you're working another person.
Right.
So you can take care of yourself.
And that's one of the things that, Stephanie, you've got a few other things. I'm going to grab them real quick. Tell us about some of the other products.
My daughter had a horse slinky with this on. You know, when you walk to rodeos and things, a lot of times your horse won't rest, it won't lay down. And so we have this one horse that she's just always scared to take because he's rearing up on the stall, he's doing this, he's doing that. Well, she put the slinky on him, and she sent me a picture. He was tied to the fence, laying down, sleeping with that slinky on. So
Yes,
Very unusual.
yes, they love the horses that are wearing the suits. This summer we sent several out that were fly suit combinations, and the horses that we sent them out to performed better. It was all positive, hauled better, performed better. I did have one that wasn't sleeping because he was going from barn to barn. She was hauling him in pro rodeo, and you know the noises and stuff would come up on his bow. But after he started wearing his fractal covered suit, he started resting and started performing better. So we decided, we're currently working on a dog suit that will be complete in the next couple months. But in the meantime, we made some dog bandanas that slide onto the collars. And we have different themes, you know, and like the number one is anxiety and calm. And the dogs seem to really enjoy these bandanas. So that's some of the things we're working on. Really excited about frequency apparel.
And what are the kits that you're producing later for the practitioners?
We are going to create a practitioner kit with all the organs on it. And also, like for instance, this one is meniscal tear. You know, to use where when you have a client, you can actually lay it on the knee, use the roller, use the acupressure point from the beauty kit. So you can utilize the beauty kit with these in the same way. Or if you just want to do a regular biofeedback session, whatever that may be, how you define it, you can lay this on the knee in the meantime.
While you're
actually,
working.
it's this one yesterday. I've been supposed to have meniscus surgery for probably 10 years ago, and mine was really bothering me yesterday. And after about 2 minutes,
Yes.
You just took the fractal on the fabric and laid it on your knee, right?
Yes.
Okay, so you can see how much more effective it is if you have that as you're working on a client who has a knee issue. Take the fractal, lay it there, let them look at it, let it again be on the knee. I frequently go back to the term the layering effect. You know, that we're layering frequencies, we're layering modalities. Ramona, you're amazing at that. Layering modalities, layering capabilities to get the maximum effect. Is that not what we're trying to achieve anyway? I mean, I think that that's really the key in not limiting ourselves. We don't all have expertise in every area, but at the same time, we're still learning. And that's one of the great things about this. I'm learning fractals. There's some that I am immediately drawn to, which tell me, like you said, Ramona, that we need that, right? So it's the same with our clients. I think it's okay if they, Dr. Gena, if they don't like it.
That's right.
That's okay.
That's fine.
There's nothing, again, we're all learning, we're all evolving, so I think that's okay. And I think it's interesting, I really wanted the audience to understand, you know, that we are working hard at learning. I think everybody here is still in the midst of learning. I think we're always going to be learning. That's one of the fun things about the life system. I've said this numerous times. I mean, I deal with very difficult clients. I deal with lots of people that have not been able to be healed by conventional medicine. Doctors have given up on them. Where do you go? Go to Dr. Rich. Dr. Rich can handle it all. You know, it's not true, I can't, but what I do is I have such capability. I use the Acumeridians. I'll be using frequencies, fractals a lot now that you have this product that I've given it out to a lot of my clients. It's just layering that effect so we maximize their healing, minimize the time of healing, but using the life system, we have such incredible capabilities. So again, we're just so thankful to Grace for all of her opportunity for us to have this conversation and really delve more into this concept of fractals and what we do. And she's thoroughly embraced Stephanie in her advancement of these products. And I think it's great. She has her website that you can go to, frequencyapparel.net.
Yes.
.net, not .com, people, .net, and you'll be able to see things. But she does have more products coming out in the future. So we are always learning, are we not?
Yes.
We are.
And isn't that the fun part about it? That we have such, you know, so that we have been given the opportunity to step into areas and learn from areas. I remember one of the programs that was given. I'm not going to say which one, but I was stunned at my lack of knowledge of this one program. It's probably not a program you all use very often either. But after listening to the practitioner, the depth of her knowledge in this area, I was so stunned and I almost overwhelmed that I never understood the program. So if there is a program in the life system that you have yet to understand, if you don't quite get the frequency thing, feel free to call Stephanie, feel free to call Connie and ask. Instead of being afraid of it, learn more in your own time, absorb and be comfortable with, you know, learning the fractals and learning what they can do. I can assure you that we are on a learning process, yes. Are we not? I mean, you saw the beginning product that Stephanie had done many years ago, and to see what you have now is wonderful. But we just have such a opportunity in front of us to learn so much more. So we really appreciate you this has taken a lot of effort, people. This has taken a lot of energy and effort to produce, and I appreciate you taking your time away from your busy practice to give us another layer in our practice that we can work with. So,
you guys may have already said this, but I may have missed it, but she can customize these also. Mm-hmm. So even though on your website it is 1, 2, 3, 4, 5 on the pets or whatever, these are Christmas gifts for my family this year because I'm so excited about these. And so with some of them, I just called her and I said, this is the issues that are coming up, and on the reactivity run, this is what has come up, and she helped me design the perfect pillowcase for each family member. So Christmas gifts, birthday gifts. I'm going to get a pillowcase now that there's pet ones and just put it over my dog's bed after seeing every animal in the place, go find her images and go lay on them. No matter where we're at, which place we've been at, they find those, they seek them out and lay on them, which is amazing to me.
And we do want to say the specially designed pillowcases are extra than the regular price that's on the website. So it is an individual type thing, but my goodness, it's totally worthwhile if you can give this to somebody and actually have them feel better. And maybe it is the opener to get them into biofeedback and coming in for a session, because we know there's again an uncomfortableness at times, just a lack of knowing of what biofeedback is. And if even this little cute little pet thing can bring somebody into coming in for a session because they've had a success on their animal, isn't that worth it?
Or if you have someone that is hesitant to come in for a actual biofeedback session, and if they're willing to just try a pillowcase, they're going to feel the same frequency that they will get from the session. So that will be a way to draw them in. I mean, I've had people that's tried the pillowcases before the biofeedback.
Before they get comfortable.
Yes, but this is biofeedback. This is part of the life system. And so grateful to Grace Gal for sharing this with us.
Yes.
And for making it available. And we are here. I truly believe each practitioner sitting here at the table that you could contact any of us. We love to share knowledge and we love to help people because we know if we share knowledge, just like we have today, that is that many more people that are going to be helped by either the fractal images or even coming into our offices or coming into your offices and you trying something that you've asked us about and we've shared what knowledge we have on it. Yes. So we just want this to be a tool to spread and help more people.
Absolutely. And we are continuing to learn, so this is what we're here for. Well, we thank you for attending our session today. As always, we are so thankful to Grace Gal for giving us the opportunity and for continuing to encourage us to expand our knowledge and take the time and bring a presentation to you about something like fractals, which we haven't had before. So from Dr. Gena, Connie, Stephanie, the incredible Ramona, and Tanya, and myself, Dr. Rich, thank you so much for attending, and be healthy and be well.
Thank you.
Thank you.
Hello, I'm Connie, life practitioner and co-owner of Biofeedback Wellness Center.
Hi, I'm Leanne. Welcome to Biofeedback Wellness Center.
Hello, I'm Stephanie Holland, a life practitioner and co-owner of Biofeedback Wellness Center. And over here, we have our pillowcases displayed. Okay. You'll notice the bee is on all of the pillowcases. And the bee is actually represents the attributes of Jesus Christ, just healing, good, love, all the works of Jesus. And the honeycomb in the scripture actually represents the story in the Bible about Samson. And the honeycomb is sweet, and it also is a fractal image. The honeycomb is a very beautiful fractal image. So those are the products that we're going to introduce today or during our video as utilization for fractal images. And we realized as we progressed into this journey that we're on that we're joining a group of bio-inspired people that are trying to close the gap where nature is kind of disappearing and modernization is coming in. So we have found that the fractal images are nature, and these fractal images that we're placing on these different products and getting great results in balancing the body, not only in humans, but in animals, are very effective for filling that gap.
Hi, my name is Sherry Harmon. I'm 46 years old. I have been a type 1 diabetic since I was 11 years old and have had migraines since 2000. And when I met Stephanie in Ashdown for biofeedback, it completely changed my world. I was able to have a life, and I'd gone and sleeping on this pillow, my blood sugars have gone down. I was having 5 lows a day. And so my doctor had to go down so much on my insulin, and she's amazed by it. But the biofeedback is amazing. I used to not do anything. I used to just stay on the couch or stay in the bed because my migraines were so bad, and my blood sugars would stay high because pain makes my blood sugars go high. And then whenever I got introduced to Stephanie, the biofeedback completely has changed my life. She changed my life. And so this pillowcase is amazing. It has changed my life too.
Rosie, how are you doing today? Well, we've been doing biofeedback on Rosie and for a few months, and we're using the life system on Rosie, and we're giving her balancing frequencies to help her get over her issue. And we also use the Life Beauty Kit roller to help deliver that balancing frequencies. So can you bring Rosie around here? recently we've started using these fractile bandanas, and these bandanas are just another mode that we can help the animal by layering the frequencies of that, delivering the positive balancing frequencies to the animal. We use this to help deliver the frequency to the area that we want.
What got you interested in the practice?
Well, what interested me in the biofeedback machine was I was looking for alternative ways to help my patients. And so I heard about the biofeedback machine, and then I heard about the use of the fractals, which I can send, like I did Rosie, I could send this home, and you know, Rosie's getting that balancing frequency all the time with these little fractals. And it also helps me kind of discover, it just kind of helps me narrow down stressors that the animal may be feeling, and kind of prioritize and see which one is what that we need to work on. And I actually have found that emotionally, there's things that I don't even consider emotionally, and the biofeedback machine has really caused my eyes to open up to a lot of emotional things that the dogs or cats or whatever animal that I use it on is going through, things I wouldn't even have dreamed of in that. So that's kind of where I got started using it.
Dr. Gena, I'm not really comprehending how these fractal images work. How do
Okay. Well, we use it, this is called a practitioner's kit, and it has several different organs on these little fractals. And what we do with these, we lay these in the areas that we need them, that we're trying to focus on, and it takes and enhances our effect of our frequency. And this is called a practitioner's kit that we use. So lots of times I just take the ones that I use the most and put them on top. So let me find one for Rosie here. And we're gonna lay this right here on her hip. We're gonna work on her musculoskeletal. And then I just roll my roller across this little fractal. See that little image? How it has a lot of different designs in it and things?
Yeah.
And what that does, that just picks up that those frequencies.
Oh.
And it just helps deliver that balancing energy. If I take this off, these are made where I can take them off, and I'm gonna just try to take this off here, and it lays a much flatter, and lay the rest of them up here, and then we can just lay it like that, and I just kind of hold it on there, and we just go over our fractal image. And see, she likes that. That feels good to her.
This all seems very complicated.
It's balance and harmonizing her body, giving her a sense of well-being. Thank you for joining us at Southside Vet Clinic, and we hope you enjoyed the rest of our practitioner seminar.